Ravi Kumar. I have a company called Exciton Diagnostics, which is in the space of medical diagnostics. Though my training was psychiatry and then I did a PhD in neurosciences, I shifted to infectious diseases. 93, when I started a company in Bangalore, every one of my friends told me I'm doing something wrong. I should be either in Chennai or in Mumbai, because that's where the medical technologies will first start anything. I said no, and I think today I'm correct.
Because of today that you don't want Chennai, or
It's because I think, in 93, 94, when I was looking for, I asked, what are the ingredients that are there in Bangalore? The most important thing is tremendous technical support from University of Science, and National Center for Biological Sciences is being formed at that time. And there is phenomenal intellectual pool there, and that could be tapped for any problem solving. And I believe that this sector, in this diagnostic sector, is something which requires a lot of invention. And that invention cannot happen in just a simple industrial environment. It has to happen in an inventive environment, and that is present in Bangalore. Now, you might ask, what is so great about diagnostics? If some of you might think that at the end of the day, it's a pill that cures you, I'm sorry that as we are finishing this session, 1,200 people would have been dead with sepsis alone in this world. And out of them, 1,150 without a diagnosis. All the 1,150 could be saved if you have a diagnosis. That's the point. It is that profound. Today, if you want to treat any cancer, it is diagnostics which determine what you do, what drug you're going to give, or are you going to give a radiotherapy, or you're going to do a surgery. Everything depends on diagnostics. So it is a phenomenal sector, and there is a lot of research to be done. And we have somebody, Kiran already mentioned that we have NIMHANS from the medical institutions, St. John's Medical College, Kidwai, and in private sector we have HCG for cancer. We have University of Science, National Center for Biological Sciences, and JNC for scientific support. And I don't think this kind of environment is present in any other place. And of course, a whole lot of corporate hospitals full of enthusiastic doctors who are willing to walk with you in the research area. And most important thing that I have to tell you is, in 93, 94, at least, we were looking for mentors. And mentors always in the pharmaceutical sector, and there were mentors only in Karnataka. At that time, I could find two of them, Kiran, who invested in my company later on, and Dr. Babu, who started what is called Bangalore Genie Private Limited. So, it's that for you to go and ask somebody, I'm in a jam, were you in such a jam, and how did you solve that? You need some people, and that is a plenty in Karnataka. And this is the first state which had a biotech policy in 2003. It stunned everybody. When that day S.M. Krishnaji read out the biotech policy, it was a sensation in this country. There's no other state like this, with that kind of focus in life sciences. I understand it may be not drug discovery, but life science is not just drug discovery. There's a whole lot of other things, and I think in diagnostic sector, and of course, by the way, there are about, now I sit with the BIRAC grants, and there are about, in last 3 calls, we have about 15 diagnostic industries which have started very innovative products in this city, in and around NCBS campus. And I think that speaks volumes, because these projects have got distilled from ideas to proof of concept. Now they have actually solid material to present to the population and to the doctors for clinical trials. And I think that is the great opportunity that is awaiting. And one caution, but people think diagnostics is an area which is regulatorily very, there's not a big task. I'm sorry, regulatory hurdles are equally bad, and it is tough to do clinical trials in diagnostics as well. But if you can do that, it can only be done in this city. Phenomenal amount of medical support is there, and thank you. I thought we will discuss if there is anything further.